Hi, this is Asia Jackson. I chose ovarian cancer to do my research on. Each year, approximately 200,000 women are diagnosed with ovarian cancer. The costs of ovarian cancer are dependent on the age of the patient, phase of care, and geographic region. Per study completed with 7,913 patients, the average cost per year for ovarian cancer was more than $200,000 for initial care, between $26,000 and $88,000 during continuing care, and more than $129,000 during the end of life care phase. Older patients sustain higher costs during continuing care phase and lower costs during end of life phase than younger patients. As more effective and advanced treatments become available in hopes of increasing the survival rate, more interventions will be needed to reduce the cost of care. Ovarian cancer is the number one cancer that women die from. The risk for a woman developing ovarian cancer is 1 in 87, and the chance of dying from it is 1 in 130. Ovarian cancer is usually diagnosed in older women, and it is more prevalent in white women than black women. The incidence rate has decreased by 1% from 1990 to mid-2010s and nearly 3% from 2015 to 2019. The deaths from ovarian cancer have decreased by 40% since 1975. The understanding of the factors that contribute to ovarian cancer will ultimately continue to decrease the mortality rate. 90% of ovarian cancers are located in the epithelial region, and the prognosis of the patient is heavily dependent upon what is present in the tumor microenvironment. A component that is linked to poor prognosis is cancer-associated fibroblasts, as they differentiate and then supports tumor cell growth by forming new blood vessels and spreading the now mutated cells to other areas of the body, with added support from what used to be immunosuppressive cells. The pathogenesis is typically broken down by ovarian or tubal categories, and the ovarian portion can come from endometriosis or constant development of cysts that undergo Müllerian metaplasia, while the tubal subtype is caused by secretory cells between the tubal serosa mesothelium and epithelium of the fallopian tube, which is connected to lymph nodes, leading to further metastases of tumor cells. Another take on the pathogenesis of ovarian cancer is oxidative stress increased activity of pro-oxidant enzymes and decreased activity of antioxidant enzymes. The oxidative stress causes the cancer cells to behave as though oxygen is not present and therefore undergo anaerobic metabolism, which increases the lactic acid production, which promotes further tumor growth and damages the surrounding tissues. Since ovarian cancer has shown to remain in this pro-oxidant state, treatments have been aimed at making the ovarian cells undergo oxidative phosphorylation versus glycolysis in order to have successful apoptosis. However, further research is needed as this disease continues to show signs of resistance to chemotherapy and mutations caused by the same chemotherapy. The clinical manifestations of ovarian cancer are oftentimes not alarming or generalized, resulting in the disease progressing to advanced stages. The Gulf Index was created in 2004, and variations of this model continue to be used worldwide. This, along with the NICE tool, were used to group symptoms of ovarian cancer. The symptoms that were reported by more than 10% of the research study used were as follows: abdominal or pelvic pain, which was in 90% of the women; abdominal bloating, change in bowel habits, decreased appetite; weight loss, lump felt by a woman; breathing issues; vaginal bleeding; increased urination; nausea, while 2.3% reported no symptoms at all. The symptoms mentioned in this study were similar, if not identical, to those reported in other studies and were a direct reflection of the disease progression and what steps should be taken to further diagnose and treat the individual. Even though the disease has been studied for nearly 200 years, they are still not a perfect tool devised to detect the disease in its early stages. Abdominal bloating and pain are often the leading symptoms of ovarian cancer, but these symptoms are frequently attributed to other gastrointestinal problems as they are general and not very alarming, which leads to the progression of the tumor. Once the disease progresses, the patient typically reports more severe symptoms such as intense pelvic pain and even vaginal bleeding. When a doctor suspects ovarian cancer, a thorough personal and familial medical history should be obtained, a physical involving a rectal and vaginal exam, laboratory tests looking for the tumor marker cancer 125, and most importantly, determining what portion of the abdominal cavity is affected. The cancer 125 marker is associated with other malignancies and reproductive disorders and should not be used as the only tool to determine the presence of ovarian cancer. The only sure way of assessing the tumor load is via imaging, whether CT, MRI, ultrasound, color Doppler, with the vaginal route being the most sensitive in advanced stages, chest x-ray, and bone scan. During the earlier stages of ovarian cancer, it is typically diagnosed by accident from what was thought to be a benign tumor, and in the later stages, observed during a gynecological exam because of the ovary twisting and therefore requiring laparoscopic abdominal surgery. Ovarian cancer continues to be a significant threat to women as the challenges of diagnosing in the early stages persist, and therefore the prognosis also remains poor. Though diagnostic methods have advanced, there is still not an effective method that is low cost and adequate enough for screening the normally healthy woman. And it is therefore critical that women who are at an increased risk have more frequent screenings. There is no known way to prevent ovarian cancer. However, there are ways to decrease the chances of it developing. They are as follows: using oral contraceptives, tubal ligation, breastfeeding for at least a year, having one or more children, avoiding hormone replacement therapy after menopause, maintaining a healthy weight, and genetic testing. There are several different treatment options, many of which are combined to enhance their effects, as the mechanism of actions are unique for each therapy and increase the likelihood of survival. The newer treatments for ovarian cancer are aimed at slowing the progression of the tumor by stopping the growth of the cells that make up the tumor and ultimately improving the quality of life for the patients. Targeted therapies aim for individualized and more accurate treatment by attacking the molecular mutations that make ovarian cancer progression possible, while immunotherapy is aimed at increasing the body's immune response to the cancer cells via administration of cancer vaccinations. Both immunological and targeted therapies are advancements in the treatment of ovarian cancer. However, the obstacles of drug resistance and finding the most effective combination of these therapies based on the cellular level of the tumor and the host response is important for choosing the right combination, as one treatment is not sufficient in this aggressiveness of the disease process. Since the current treatments and diagnostic methods are not the best at tackling the disease progression of ovarian cancer. My nurse midwifery practice will have an increased focus on early detection via thorough gynecological exams, patient education on risk factors and symptoms, genetic counseling referrals when appropriate, and providing ongoing support to patients diagnosed with ovarian cancer, including managing treatment side effects and addressing psychological concerns throughout the care journey, as ovarian cancer is such a taxing disease. Therapies would include psychology consults, group therapy for women with the same diagnoses, and a faith-based therapy option as well. And these are my references. Thank you all for watching.